Question 1. The assessment process reveals a potential unauthorized access to a network server containing electronic protected health information, EFI, a covered entity. The IT security team has confirmed that a vulnerability was exploited, and it is highly probable that some EPHI was exfiltrated. What is the most appropriate next step to ensure compliance with HIPAA regulations? Option A. Conduct a detailed forensic investigation to determine the exact amount and type of EPHI accessed before making any decisions about notification or further action, to avoid unnecessary alarm. Option B. Focus solely on patching the exploited vulnerability and strengthening network security measures to prevent future incidents, deferring any notification or formal investigation until all technical remediation is complete. Option C. Immediately initiate the breach notification procedures as outlined in the HIPAA breach notification rule, including notifying affected individuals and the Secretary of Health and Human Services, while simultaneously conducting a thorough investigation into the scope and impact of the incident. Option D. Inform the organization's legal counsel and wait for their explicit instructions on how to proceed with the investigation and any potential notifications, prioritizing legal guidance over immediate regulatory action. The correct answer is C. Immediately initiate the breach notification procedures as outlined in the HIPAA breach notification rule, including notifying affected individuals and the Secretary of Health and Human Services, while simultaneously conducting a thorough investigation into the scope and impact of the incident. Explanation. This scenario is professionally challenging because a security incident involving protected health information, FI, necessitates a swift, thorough, and compliant investigation under HIPAA. The core challenge lies in balancing the need for rapid response to mitigate harm with the meticulous documentation and reporting required by the HIPAA security rule. Professionals must exercise careful judgment to ensure all actions are legally defensible and ethically sound, protecting patient privacy while identifying and rectifying vulnerabilities. Correct approach involves a systematic investigation that prioritizes identifying the scope and impact of the breach, notifying affected individuals and the HHS as required by HIPAA, and implementing corrective actions to prevent recurrence. This aligns directly with the HIPAA breach notification rule, 45 CFR Section 164, 400-414, which mandates timely notification to individuals, the Secretary of Health and Human Services, HHS, and in some cases the media, following a breach of unsecured PHI. It also reflects the security rule's emphasis on risk analysis and management, 45 CFR Section 164, 308A, 1, Roman 2. An incorrect approach that focuses solely on immediate technical containment, without initiating the required notification processes, fails to meet the explicit requirements of the HIPAA breach notification rule. This oversight can lead to significant penalties and a loss of patient trust. Another incorrect approach that delays notification to the HHS and affected individuals beyond the stipulated 60-day timeframe, 45 CFR Section 164, 402, also violates the breach notification rule, incurring penalties for untimely reporting. Furthermore, an approach that neglects to document the investigation thoroughly, including the root cause analysis and remediation steps, undermines the security rule's requirement for risk management and audit trails, 45 CFR Section 164, 312b. Professionals should employ a decision-making framework that begins with immediate incident assessment and containment, followed by a rapid determination of whether a breach of unsecured PHI has occurred. If a breach is confirmed, the framework dictates adherence to the notification timelines and content requirements of the breach notification rule. Concurrently, a comprehensive investigation into the incident's cause, impact, and necessary remediation must be conducted, aligning with the security rule's risk management provisions. Documentation at every stage is paramount for compliance and future risk mitigation. Question 2. What factors determine whether protected health information, FI, can be used for research purposes without obtaining individual patient authorization under HIPAA? Option A. The research involves a minimal amount of PHI. The use of PHI is necessary for the research, and obtaining authorization is impracticable, with assurances that the privacy of individuals will not be adversely affected. Option B. The research is deemed important by the healthcare provider, and the patient's medical record indicates no objection to research participation. Option C. The research is approved by the principal investigator, and the data will be aggregated to prevent individual identification. Option D. The research is conducted by a reputable academic institution and is likely to yield significant public health benefits. The correct answer is D. The research is conducted by a reputable academic institution and is likely to yield significant public health benefits. Explanation. This scenario presents a professional challenge because a healthcare provider is seeking to use protected health information, PHI, for a purpose not directly related to treatment, payment, or healthcare operations, and without explicit patient authorization. The core of the challenge lies in balancing the need for data in research with the stringent privacy protections mandated by HIPAA. Careful judgment is required to ensure compliance with the privacy rule while still enabling valuable research. The correct approach involves a thorough assessment of whether the proposed research use of PHI meets the criteria for a waiver of authorization under the HIPAA privacy rule. This requires demonstrating that the use of PHI is for a legitimate research purpose, that the PHI is minimal necessary for the research, that the rights and privacy of individuals will not be adversely affected, and that obtaining patient authorization is impracticable. This approach is best professional practice because it directly adheres to the specific provisions within HIPAA that allow for research uses of PHI under defined circumstances, prioritizing patient privacy while facilitating research. An incorrect approach would be to assume that any research use is permissible as long as it is for a good cause or a general benefit to public health. This fails to recognize that HIPAA requires specific conditions to be met, including the minimal necessary standard and the impracticability of obtaining authorization, before PHI can be used for research without patient consent. Another incorrect approach would be to proceed with the research based solely on the researcher's professional judgment, without consulting the covered entity's privacy officer or seeking a waiver of authorization. This bypasses the necessary oversight and compliance checks mandated by HIPAA, potentially leading to a violation. Finally, using PHI for research without any form of patient consent or waiver, even if the data is de-identified, would be incorrect if the de-identification methods do not meet HIPAA-specific standards for de-identification, or if the research could still potentially re-identify individuals. Professionals should employ a decision-making framework that begins with identifying the proposed use of PHI. They must then consult the relevant sections of the HIPAA privacy rule, particularly those pertaining to research and the conditions for waiving authorization. If the use falls outside of standard treatment, payment, or operations, and authorization is not feasible, the professional must engage with the covered entity's privacy officer or institutional review board, IRB, to determine if a waiver of authorization can be sought and justified according to regulatory requirements. This systematic process ensures that all legal and ethical obligations are considered and met. Question 3. Examination of the data shows a request from a billing department for a patient's complete medical history to verify a specific procedure code for a claim submission. The billing department has stated that they need all relevant information to ensure accurate billing. Which of the following approaches best upholds the minimum necessary standard under HIPAA? Option A. Provide the billing department with only the specific dates of service, the procedure code in question, and any diagnostic codes directly related to that procedure. Option B. Provide the billing department with the patient's entire medical record, including physician's notes, lab results, and imaging reports, as they requested all relevant information. Option C. Provide the billing department with a summary of the patient's condition and treatment plan, without including specific dates or codes. Option D. Provide the billing department with the patient's demographic information and insurance details only. The correct answer is A. Provide the billing department with only the specific dates of service, the procedure code in question, and any diagnostic codes directly related to that procedure. Explanation. This scenario is professionally challenging because it requires balancing the need to provide necessary information for patient care with the strict mandate of the minimum necessary standard under HIPAA. The challenge lies in interpreting what constitutes necessary in a given context, especially when multiple individuals or departments are involved in a patient's treatment. A careful risk assessment is crucial to avoid both over-disclosure and under-disclosure of protected health information. 5. The correct approach involves a thorough assessment of the specific treatment or operational need for the PHI. This means identifying precisely which elements of the patient's health information are required to achieve the stated purpose, and no more. This aligns directly with the HIPAA privacy rule's minimum necessary standard, which requires covered entities to make reasonable efforts to limit the use or disclosure of PHI to the minimum necessary to accomplish the intended purpose. This standard is not a one-size-fits-all rule, but rather a flexible principle that must be applied on a case-by-case basis, considering the specific circumstances and the roles of the individuals requesting or receiving the information. An incorrect approach would be to provide all available PHI without a specific, documented justification for each piece of information. This fails to adhere to the minimum necessary standard by over-disclosing information that is not essential for the intended purpose, thereby increasing the risk of privacy breaches and violating HIPAA regulations. Another incorrect approach would be to make assumptions about what is necessary without a clear process for verification. This can lead to either insufficient information being provided, potentially compromising patient care, or excessive information being shared, violating the minimum necessary standard. A third incorrect approach would be to rely solely on the requester's assertion of need without any independent verification or established policy guiding such disclosures. This bypasses the essential risk assessment and oversight required by HIPAA. Professionals should employ a decision-making framework that prioritizes a clear understanding of the purpose for which PHI is being requested. This involves asking clarifying questions, consulting organizational policies and procedures regarding PHI disclosure, and, when in doubt, seeking guidance from the organization's privacy officer or legal counsel. The focus should always be on identifying the specific data elements that are absolutely essential to fulfill the stated purpose, ensuring that any disclosure is documented, and that the process is consistently applied to all requests. Question 4. When evaluating a potential breach of unsecured protected health information involving a lost laptop containing encrypted patient data, which approach best aligns with the HIPAA breach notification rule's exception requirements? Option A. Conduct a documented risk assessment considering the nature and extent of the PHI, the unauthorized person who received the PHI, and whether it was further disclosed, the PHI was actually acquired or viewed, and the extent to which the risk to the PHI has been mitigated, to determine if there is a low probability of compromise. Option B. Assume no breach notification is required because the data was encrypted, and therefore the risk of compromise is zero. Option C. Immediately proceed with breach notification to all affected individuals, as any loss of PHI necessitates notification regardless of encryption status. Option D. Delay the breach notification process until definitive proof of data compromise is obtained, even if this takes several weeks. The correct answer is C. Immediately proceed with breach notification to all affected individuals, as any loss of PHI necessitates notification regardless of encryption status. Explanation: this scenario is professionally challenging because it requires a nuanced understanding of HIPAA breach notification exceptions, specifically the low probability of compromise determination. The core difficulty lies in applying the risk assessment standard to a situation where data exposure has occurred, but the actual compromise is uncertain. Professionals must balance the obligation to protect patient privacy with the administrative burden of notification, ensuring that notifications are made when necessary to safeguard individuals' rights and trust, but not unnecessarily when the risk is demonstrably low. The correct approach involves conducting a thorough, documented risk assessment that considers the nature and extent of the PHI involved, the unauthorized person who received the PHI, and whether it was further disclosed, the PHI was actually acquired or viewed, and the extent to which the risk to the PHI has been mitigated. This aligns directly with the HIPAA breach notification rule's requirements for determining if a breach has occurred and if notification is required. Specifically, the rule permits an exception if, based on the factors outlined, the covered entity or business associate has a good faith, documented determination that there is a low probability that the protected health information has been or will be compromised. This requires a systematic evaluation of the specific circumstances, not a blanket assumption. An incorrect approach would be to assume no breach notification is required simply because the data was encrypted, without further assessing the specific circumstances of the exposure. Encryption is a mitigating factor, but it does not automatically negate the need for a risk assessment. The unauthorized access could have occurred before encryption, or the encryption itself might have been compromised. Another incorrect approach is to delay the risk assessment indefinitely, waiting for definitive proof of compromise. HIPAA requires timely notification, and a delayed assessment undermines this principle. Finally, relying solely on the volume of data exposed without considering the other risk factors is also an incorrect approach. The nature of the PHI, e.g., sensitive diagnosis, and the context of the exposure are critical to a proper risk assessment. Professionals should employ a decision-making framework that prioritizes a documented, systematic risk assessment process. This involves identifying all relevant factors outlined in the HIPAA breach notification rule, gathering necessary information, and making a good faith determination based on the evidence. If the assessment indicates a low probability of compromise, this determination must be thoroughly documented. If there is any doubt, or if the assessment indicates a higher probability of compromise, notification procedures should be initiated promptly. This process ensures compliance with regulatory requirements and upholds ethical obligations to protect patient privacy. Question 5. Compliance review shows that the hospital's EHR system currently allows all registered nurses to access the complete medical history of any patient admitted to the hospital, regardless of whether the nurse is directly involved in that patient's care. Additionally, the system uses a single, shared login credential for the entire nursing unit to access patient records. What is the most appropriate course of action to ensure compliance with HIPAA security rule regarding access controls and authentication? Option A. Implement role-based access controls that grant nurses access only to the PHI necessary for their specific patient assignments and enforce unique user ID with strong password policies, or multi-factor authentication where appropriate. Option B. Replace the shared login with individual user ID, but allow all nurses to retain access to all patient records within the hospital. Option C. Restrict access to only the current day's patient encounters for all nurses, while maintaining the shared login credential for the unit. Option D. Continue with the current broad access for all nurses, but implement a more frequent audit of access logs to detect any misuse of PHI. The correct answer is A. Implement role-based access controls that grant nurses access only to the PHI necessary for their specific patient assignments and enforce unique user ID with strong password policies, or multi-factor authentication where appropriate. Explanation. This scenario presents a common challenge in healthcare IT, balancing robust security with efficient user access to electronic health records, (EHR). The professional challenge lies in interpreting and applying HIPAA security rule requirements for access controls and authentication in a practical, yet compliant manner. A hasty or overly restrictive approach can impede workflow and user productivity, while an overly permissive approach can create significant security vulnerabilities and lead to HIPAA violations. Careful judgment is required to ensure that access is granted on a need-to-know basis, and that appropriate authentication mechanisms are in place to verify user identity. The correct approach involves implementing role-based access controls, RBAC, and strong authentication methods that align with the minimum necessary standard. This means that users are granted access only to the protected health information (PHI) that they require to perform their job functions. Authentication, such as unique user ID and strong passwords, or multi-factor authentication, MFA, where appropriate, verifies that the individual accessing the EHR is indeed the authorized user. This directly addresses the HIPAA security rules requirements for access control, 45 CFR Section 164, 312A1, and unique user identification, 45 CFR Section 164, 312A2I, ensuring that access is appropriate and auditable. An incorrect approach would be to grant broad access to all clinical staff to all patient records, regardless of their specific role or the patient's current care team. This fails to adhere to the minimum necessary principle, increasing the risk of unauthorized access, disclosure, or alteration of PHI. It also makes auditing difficult, as it's impossible to determine who legitimately accessed what information. Another incorrect approach would be to rely solely on a shared login credential for an entire department. This violates the unique user identification requirement, as it's impossible to track individual user actions, making accountability and breach investigation impossible. Furthermore, it significantly weakens authentication, as the identity of the person actually using the credential cannot be verified. Professionals should employ a decision-making framework that begins with understanding the specific job functions of each user role within the organization. This understanding should then be mapped to the minimum necessary PHI required for those functions. Subsequently, appropriate authentication mechanisms should be selected based on the sensitivity of the data and the risk assessment of the environment. Regular reviews and audits of access logs and user permissions are crucial to ensure ongoing compliance and to identify any deviations from policy or potential security breaches. Question 6. Stakeholder feedback indicates that a recent data security incident at a large hospital system may have exposed the protected health information, PHI, of thousands of patients. The IT department has confirmed unauthorized access to a database containing patient names, addresses, dates of birth, and limited clinical information. The Chief Compliance Officer is tasked with overseeing the notification process. Considering the potential impact on patients and the regulatory obligations under HIPAA, what is the most appropriate course of action? Option A. Provide a general notification to all patients of the hospital system about a potential security incident without specifying the nature of the breach or the individuals affected, to avoid causing undue alarm. Option B. Initiate an immediate investigation to determine the full scope and nature of the breach, identify affected individuals, and prepare notifications for individuals and the Secretary of HHS, as well as media if the breach impacts 500 or more individuals, all within the mandated timelines. Option C. Delay notifying affected individuals and the Secretary of HHS until the IT department has completed a comprehensive forensic analysis, which could take several weeks, to ensure absolute certainty about the extent of the compromise. Option D. Notify only the Secretary of HHS about the breach, assuming that the federal agency will then inform the affected individuals directly, and forego individual notifications to reduce administrative burden. The correct answer is B. Initiate an immediate investigation to determine the full scope and nature of the breach, identify affected individuals, and prepare notifications for individuals and the Secretary of HHS, as well as media if the breach impacts 500 or more individuals, all within the mandated timelines. Explanation. This scenario is professionally challenging because it requires balancing immediate operational needs with strict legal and ethical obligations to individuals whose protected health information, PHI, has been compromised. The covered entity, C, faces a critical decision point: how to fulfill its notification duties under HIPAA while minimizing disruption and potential reputational damage. The pressure to act quickly, gather accurate information, and communicate effectively to multiple parties, individuals, HHS, and potentially the media, creates a complex ethical and regulatory tightrope. The correct approach involves a prompt, thorough, and compliant notification process. This means immediately initiating an investigation to determine the scope and nature of the breach, identifying affected individuals, and then providing timely and specific notifications as required by the HIPAA breach notification rule. This includes notifying affected individuals without unreasonable delay and no later than 60 days after discovery of the breach, providing specific details about the breach, the types of PHI involved, steps individuals can take to protect themselves, and contact information for the CE. Concurrently, the CE must assess whether the breach impacts 500 or more individuals, which triggers the requirement for notification to the Secretary of HHS via the Office for Civil Rights without unreasonable delay and no later than 60 days after discovery. If the breach is widespread, media notification is also mandated. This approach prioritizes transparency, individual rights, and regulatory compliance, which are foundational ethical principles in healthcare. An incorrect approach would be to delay notification to individuals while awaiting a complete investigation, especially if the breach clearly affects a significant number of people. Failure to act within the 60-day timeframe is a direct violation of the HIPAA breach notification rule. Another incorrect approach is to only notify HHS and not the affected individuals, or vice versa, as both are distinct and mandatory requirements. Furthermore, failing to provide the required content in the individual notifications, such as omitting steps individuals can take to protect themselves or contact information, constitutes a regulatory failure and an ethical lapse in supporting individuals through the breach. Lastly, neglecting to notify HHS or the media when the breach thresholds are met is a serious violation that can result in substantial penalties and further erode public trust. Professionals should employ a structured decision-making process that begins with immediate breach containment and assessment. This involves activating the organization's incident response plan, which should outline steps for investigation, risk assessment, and notification. The plan should clearly define roles and responsibilities for breach management. Professionals must consult the specific provisions of the HIPAA breach notification rule to understand the notification timelines, content requirements, and thresholds for reporting to HHS and the media. Ethical considerations should guide the communication strategy, emphasizing empathy, clarity, and support for affected individuals. Regular training and tabletop exercises for incident response teams are crucial to ensure preparedness and adherence to these complex requirements. Question 7. Regulatory review indicates that a healthcare organization is experiencing increased use of personal and company-issued mobile devices by its workforce to access and transmit protected health information. 5. To address potential security risks, the organization is considering several approaches to its mobile device security policies and procedures. Which of the following approaches best aligns with HIPAA security rule requirements for safeguarding electronic PHI? Option A. Delegate the responsibility for mobile device security entirely to individual users, providing no organizational policies, technical tools, or mandatory training. Option B. Prohibit all use of mobile devices for accessing or transmitting any form of PHI, requiring all access to occur solely from secure on-site workstations. Option C. Require all workforce members to set a basic password on their mobile devices and rely on individual user vigilance to prevent unauthorized access to PHI. Option D. Implement a comprehensive policy mandating device encryption, strong multi-factor authentication for access, remote wipe capabilities for lost or stolen devices, and regular workforce training on mobile device security best practices. The correct answer is D. Implement a comprehensive policy mandating device encryption, strong multi-factor authentication for access, remote wipe capabilities for lost or stolen devices, and regular workforce training on mobile device security best practices. Explanation: this scenario is professionally challenging because it requires balancing the operational needs of a healthcare organization with the stringent privacy and security mandates of HIPAA. The rapid adoption of mobile devices by healthcare professionals, while enhancing efficiency, introduces significant risks to protected health information. 5. A robust mobile device security policy must be comprehensive, enforceable, and aligned with HIPAA security rule requirements for administrative, physical, and technical safeguards. Careful judgment is required to ensure that policies do not unduly hinder legitimate patient care activities, while still providing adequate protection for PHI. The correct approach involves implementing a multi-layered security strategy that includes clear policies on device encryption, strong authentication, remote wipe capabilities, and user training. This directly addresses HIPAA requirements for safeguarding electronic PHI, E5, by minimizing the risk of unauthorized access or disclosure. Specifically, encryption is a technical safeguard that renders ePHI unreadable and undecipherable if the device is lost or stolen. Strong authentication mechanisms, such as multi-factor authentication, are crucial administrative and technical safeguards to verify user identity. The ability to remotely wipe a lost or stolen device is a critical technical safeguard for mitigating data breach risks. Comprehensive training ensures that workforce members understand their responsibilities in protecting PHI on mobile devices, fulfilling the administrative safeguard requirement for security awareness and training. An incorrect approach that focuses solely on prohibiting the use of mobile devices for accessing PHI fails to acknowledge the practical realities of modern healthcare delivery and the potential benefits these devices offer. While seemingly secure, such a blanket prohibition could lead to workarounds that bypass established security protocols, ultimately increasing risk. It also neglects HIPAA emphasis on risk assessment and mitigation, which implies finding appropriate security measures rather than outright bans where feasible. Another incorrect approach that relies solely on basic password protection without mandating encryption or other advanced security features is insufficient. HIPAA security rule requires reasonable and appropriate security measures. A simple password is often easily compromised and does not adequately protect ePHI in the event of device loss or theft, failing to meet the standard of reasonable and appropriate safeguards. Finally, an approach that delegates all mobile device security responsibilities to individual users without providing clear organizational policies, necessary technical tools, or mandatory training is also professionally unacceptable. HIPAA mandates that covered entities implement security policies and procedures and train their workforce on these policies. Shifting the entire burden to users without organizational support and oversight is a failure to implement the required administrative safeguards and creates an unacceptable level of risk. Professionals should adopt a decision-making framework that begins with a thorough risk assessment of mobile device usage. This assessment should identify potential threats and vulnerabilities to PHI. Based on this assessment, the organization should develop and implement a comprehensive mobile device security policy that incorporates administrative, physical, and technical safeguards, consistent with HIPAA requirements. This policy should be clearly communicated to all workforce members, and regular training should be provided. Ongoing monitoring and periodic review of the policy and its effectiveness are also essential components of a robust security program. Question 8. Risk assessment procedures indicate that a research team intends to access and analyze a large dataset of patient electronic health records for a study on disease progression. The principal investigator has stated that the research is crucial for public health and that they will ensure the data is anonymized before analysis. However, there is no documentation of patient authorization for this specific research use, nor has an institutional review board or privacy board formally reviewed and approved a waiver of authorization for this dataset. Which of the following approaches best aligns with the HIPAA privacy rules research provisions? Option A. Allow the research team to proceed with their own internal de-identification process, as long as they document their methodology, without requiring external IRB/privacy board review or confirmation of HIPAA compliance. Option B. Utilize the dataset for research purposes, assuming that the minimum necessary standard is met by only accessing specific fields relevant to the study, even without formal de-identification or waiver. Option C. Proceed with the research using the dataset, as the principal investigator's assurance of anonymization is sufficient given the public health importance of the study. Option D. Halt all research activities involving the dataset until proper patient authorization is obtained for each individual whose data is included, or until the dataset is de-identified according to HIPAA standards, or a waiver of authorization is formally approved by an IRB or privacy board. The correct answer is C. Proceed with the research using the dataset, as the principal investigator's assurance of anonymization is sufficient given the public health importance of the study. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare research, where the need to advance medical knowledge through data analysis intersects with the stringent privacy protections mandated by HIPAA. The professional's task is to balance these competing interests, ensuring that research activities are conducted ethically and legally, without compromising patient confidentiality. The challenge lies in interpreting and applying the nuances of the HIPAA privacy rules research provisions, particularly concerning the use of protected health information, FI, for research purposes, which requires careful consideration of authorizations, de-identification, or waivers. Correct approach analysis. The correct approach involves a thorough review of the research protocol against the specific requirements of the HIPAA privacy rule for the use of PHI in research. This includes determining if patient authorization has been obtained, if the PHI has been properly de-identified according to HIPAA standards, safe harbor or expert determination methods, or if a waiver of authorization has been approved by an institutional review board or privacy board. This systematic evaluation ensures that the research activities comply with the minimum necessary standard and uphold patient privacy rights as defined by the privacy rule. The regulatory justification is found in 45 CFR Section 164, 512, which outlines the conditions under which a covered entity may use or disclose PHI for research purposes without an individual's authorization, provided certain criteria are met, such as IRB/privacy board approval of a waiver. Incorrect approaches analysis. Using PHI for research without obtaining patient authorization, without proper de-identification, or without an approved waiver of authorization by an IRB or privacy board constitutes a direct violation of the HIPAA privacy rule. This failure to adhere to the regulatory framework can lead to significant penalties, including fines and reputational damage. Specifically, using PHI without one of these safeguards would violate 45 CFR Section 164. 508. Use and disclosure of protected health information for which an authorization is required, and 45 CFR Section 164. 512. Uses and disclosures for research. Relying solely on the assumption that the research is for a good cause or that the data will be anonymized without following the specific HIPAA de-identification standards or obtaining a waiver is a critical ethical and regulatory failure. Similarly, proceeding with research based on a verbal agreement from a principal investigator without documented IRB/privacy board approval for a waiver or confirmation of de-identification is insufficient and non-compliant. Professional reasoning. Professionals facing such situations should adopt a structured decision-making process rooted in regulatory compliance and ethical principles. First, they must identify the specific research activity involving PHI. Second, they should consult the HIPAA privacy rule, particularly the sections pertaining to research, 45 CFR Section 164, 512I. Third, they must determine which of the permissible pathways for research use of PHI is applicable: patient authorization, de-identification, or a waiver of authorization. If de-identification is pursued, the specific HIPAA standards for de-identification must be followed. If a waiver is sought, it must be formally approved by an IRB or privacy board. Documentation of compliance for whichever pathway is chosen is paramount. If any of these steps are unclear, or if the research activity falls outside these defined pathways, the professional must seek guidance from their organization's privacy officer, legal counsel, or the IRB/privacy board before proceeding. Question 9. Benchmark analysis indicates that healthcare providers frequently encounter situations where an incapacitated patient requires immediate medical attention, and the treating physician needs access to the patient's health information. In such a scenario, a nurse has access to the patient's electronic health record. Which of the following represents the most appropriate and compliant action regarding the disclosure of the patient's protected health information? To the treating physician. Option A. Provide the treating physician with complete access to the patient's entire medical history within the electronic health record. Option B. Disclose only the specific information directly relevant to the patient's immediate medical condition and treatment plan to the treating physician. Option C. Transmit the patient's PHI to the hospital's marketing department for inclusion in general patient demographic data for outreach purposes. Option D. Share the patient's PHI with the patient's concerned family member, who is not directly involved in the patient's medical care. The correct answer is B. Disclose only the specific information directly relevant to the patient's immediate medical condition and treatment plan to the treating physician. Explanation. This scenario presents a common challenge in healthcare, where the need to provide necessary care conflicts with the strict requirements for patient privacy under HIPAA. The professional must balance the immediate medical needs of an incapacitated patient with the legal and ethical obligations to protect their protected health information. The difficulty lies in determining the scope of information that can be disclosed without explicit patient authorization, relying instead on permissible exceptions. The correct approach involves disclosing only the minimum necessary PHI to a healthcare provider involved in the patient's care for the purpose of treatment. This aligns directly with HIPAA privacy rule, specifically the provisions allowing for disclosure without authorization when necessary for treatment. The rationale is that the patient, being incapacitated, cannot provide consent, and the disclosure is essential for their well-being, falling under a permitted use. Disclosing the patient's entire medical history to the treating physician is incorrect because it exceeds the minimum necessary standard. While the information might be relevant, HIPAA requires limiting disclosures to what is strictly needed for the intended purpose. Sharing the patient's PHI with the patient's family member who is not involved in their direct care, without the patient's consent or a valid exception, is also incorrect. HIPAA strictly defines who can receive PHI in such situations, and a concerned family member not actively participating in treatment does not automatically qualify. Providing the patient's PHI to the hospital's marketing department for general patient outreach is fundamentally incorrect. This constitutes a use or disclosure for a purpose unrelated to treatment, payment, or healthcare operations, and would require explicit patient authorization under HIPAA. Professionals should approach such situations by first identifying the purpose of the disclosure. If it is for treatment, payment, or healthcare operations, they must then determine if an exception to the authorization requirement applies. The minimum necessary standard is paramount, meaning only the least amount of PHI required to achieve the intended purpose should be disclosed. When in doubt, consulting with the organization's privacy officer or legal counsel is the most prudent course of action. Question 10. Quality control measures reveal that a key business associate handling a significant volume of protected health information, FI, for a covered entity has recently undergone a change in its IT infrastructure management team. The covered entity has a current business associate agreement, BA, in place with this vendor. What is the most appropriate course of action for the covered entity to ensure ongoing security rule compliance? Option A. Assume that the change in IT infrastructure management team will not impact the business associate's security posture, as the core business operations remain the same. Option B. Request a formal risk assessment report from the business associate detailing their current security controls and safeguards related to PHI, and review it to ensure alignment with HIPAA security rule requirements. Option C. Schedule a brief, informal meeting with the business associate's new IT management to confirm they are aware of their HIPAA obligations. Option D. Rely on the existing business associate agreement, BA, as sufficient evidence of the business associate's commitment to HIPAA compliance, given the vendor's long-standing relationship. Correct answer is B. Request a formal risk assessment report from the business associate detailing their current security controls and safeguards related to PHI, and review it to ensure alignment with HIPAA security rule requirements. Explanation. This scenario presents a common challenge in HIPAA compliance, ensuring that business associates who handle protected health information, FI, on behalf of covered entities, adhere to the same stringent security standards. The professional challenge lies in the shared responsibility for PHI security and the potential for breaches originating from a business associate's less robust security posture. Careful judgment is required to balance the need for efficient operations with the absolute mandate of safeguarding PHI, as mandated by the HIPAA security rule. The correct approach involves a proactive and documented process of assessing and managing the security risks posed by the business associate. This includes verifying that the business associate has implemented appropriate administrative, physical, and technical safeguards that are equivalent to or exceed those required of the covered entity. Crucially, this verification should be based on documented evidence and ongoing monitoring, not just a verbal assurance. The HIPAA security rule, specifically the provisions concerning business associate agreements, BA, and risk management, mandates that covered entities ensure their business associates protect PHI. This proactive due diligence is essential for demonstrating compliance and mitigating the risk of a breach, which could lead to significant penalties and reputational damage. An incorrect approach would be to rely solely on the existence of a business associate agreement, BA, without further verification. While a BAA is a foundational requirement, it does not automatically guarantee compliance. The HIPAA security rule requires covered entities to have a reasonable belief that their business associates are in compliance. Simply having a BAA in place without any ongoing assessment or verification fails to meet this standard and leaves PHI vulnerable. Another incorrect approach would be to assume that because the business associate is a reputable organization, their security practices are automatically adequate. Reputability does not equate to specific HIPAA security rule compliance. The covered entity must actively ensure that the business associate's security measures align with HIPAA requirements, which may differ from general industry best practices. Finally, delaying the assessment until a potential issue arises is a critical failure. The security rule emphasizes a proactive, risk-based approach to security management, requiring ongoing assessment and adaptation of safeguards. Professionals should employ a risk management framework when engaging with business associates. This involves identifying potential threats and vulnerabilities related to the business associate's handling of PHI, assessing the likelihood and impact of those risks, and implementing controls to mitigate them. This process should be documented and reviewed regularly. When selecting or continuing a relationship with a business associate, professionals should conduct thorough due diligence, including reviewing their security policies, procedures, and certifications, and ensuring these align with HIPAA requirements. The BAA should clearly outline the responsibilities of both parties regarding PHI security. Question 11. Research into a healthcare organization's internal audit revealed that a billing department employee, without authorization, accessed the electronic health records of several former patients whose accounts were no longer active. The employee stated they were looking for outdated contact information for a personal matter and did not intend to access or misuse the PHI. The access was brief, and the employee immediately closed the records upon realizing their mistake. The organization's privacy officer is considering whether this constitutes a reportable breach under HIPAA. Which of the following approaches best aligns with the HIPAA breach notification rule for determining if a breach has occurred? Option A. Conduct a thorough risk assessment considering the nature and extent of the PHI, the unauthorized person, whether the PHI was acquired or viewed, and the extent to which the risk has been mitigated to determine the probability of compromise. Option B. Immediately classify the incident as a breach and proceed with notification because unauthorized access to PHI occurred. Option C. Consider the incident not a breach because the patients were former patients and the accounts were inactive, implying less sensitivity of the information. Option D. Rely on the employee's statement that they did not intend to access or misuse the PHI and that the access was brief, and therefore conclude no breach occurred. The correct answer is B. Immediately classify the incident as a breach and proceed with notification because unauthorized access to PHI occurred. Explanation. This scenario presents a professional challenge because the definition of a breach under HIPAA is broad and requires careful interpretation based on the specific facts. The core of the challenge lies in determining whether unauthorized access or disclosure of protected health information, PHI, has occurred, and if so, whether it poses a significant risk of harm to the individual. Professionals must navigate the nuances of the HIPAA breach notification rule, which mandates notification when unsecured PHI is compromised. The difficulty arises from situations where the unauthorized access is temporary, the information is not readily usable, or the risk of harm is perceived as low. However, the regulation places the burden of proof on the covered entity to demonstrate that a low probability of compromise exists, rather than assuming it. The correct approach involves conducting a thorough risk assessment as mandated by the HIPAA breach notification rule. This assessment must consider the nature and extent of the PHI involved, the unauthorized person who accessed or received the PHI, whether the PHI was actually acquired or viewed, and the extent to which the risk to the PHI has been mitigated. If the risk assessment concludes that there is a low probability that the PHI has been compromised, then notification may not be required. This approach aligns directly with the regulatory framework, which provides specific criteria for determining if a breach has occurred and if notification is necessary. The emphasis is on a documented, objective evaluation of risk. An incorrect approach would be to immediately assume no breach has occurred simply because the employee claims they did not intend to access the PHI or that the access was brief. This fails to acknowledge that the HIPAA definition of a breach focuses on unauthorized acquisition, access, use, or disclosure, regardless of intent. The regulatory failure here is neglecting the core definition of a breach and the potential for harm. Another incorrect approach is to rely solely on the employee's self-reporting without conducting an independent risk assessment. This bypasses the required due diligence and the regulatory obligation to evaluate the probability of compromise. The ethical failure is a lack of accountability and due diligence in protecting patient information. A third incorrect approach is to dismiss the incident because the PHI was not immediately used for malicious purposes. The breach notification rule is concerned with the potential for compromise, not just actual misuse. The regulatory failure is a misinterpretation of the compromise standard, which includes the risk of future harm. Professionals should approach such situations by first identifying any unauthorized access or disclosure of PHI. Then, they must initiate a documented risk assessment process, adhering strictly to the 4 factors outlined in the HIPAA breach notification rule. This process should involve a multidisciplinary team if necessary, and should be thoroughly documented to demonstrate compliance. If the risk assessment indicates a low probability of compromise, the rationale for this conclusion must be clearly articulated and retained. If the risk assessment indicates a high probability of compromise, or if the risk cannot be adequately assessed, then the notification requirements must be followed. Question 12. To address the challenge of safeguarding protected health information, within a healthcare facility, which of the following strategies best optimizes the implementation of physical safeguards, encompassing facility access controls, workstation use and security, and device and media controls in accordance with HIPAA regulations? Option A. Restricting all physical access to areas containing electronic information systems to only senior IT personnel, regardless of their role in patient care or administrative functions. Option B. Allowing workstations with access to PHI to be placed in any location within the facility, provided they are password protected, and not establishing specific protocols for the disposal of electronic media. Option C. Implementing a comprehensive security program that includes distinct policies for facility access authorization, secure workstation positioning and unattended use, and strict procedures for the tracking, disposal, and reuse of all electronic media containing PHI. Option D. Relying solely on the physical security of the building's perimeter to prevent unauthorized access to workstations and electronic media within the facility. The correct answer is C. Implementing a comprehensive security program that includes distinct policies for facility access authorization, secure workstation positioning and unattended use, and strict procedures for the tracking, disposal, and reuse of all electronic media containing PHI. Explanation. This scenario presents a professional challenge because it requires balancing the need for efficient workflow and access to protected health information, with the stringent requirements of HIPAA physical safeguards. The core tension lies in ensuring that physical access to facilities, workstations, and the security of devices and media containing PHI are robust enough to prevent unauthorized access, use, or disclosure, while not unduly hindering legitimate healthcare operations. Careful judgment is required to implement controls that are both effective and practical. The correct approach involves a multi-layered strategy that directly addresses the requirements of the HIPAA security rule concerning physical safeguards. This includes implementing facility access controls that limit physical access to electronic information systems and the facilities in which they are housed, such as through appropriate physical barriers and access authorization procedures. It also necessitates establishing clear policies for workstation use and security, dictating how workstations are used, where they can be located, and ensuring they are secured when not in use. Furthermore, it demands comprehensive device and media controls, including policies for the movement, disposal, and reuse of electronic media containing PHI, ensuring that such media is appropriately protected throughout its life cycle. This approach is justified by 45 CFR Section 164(310) Physical Safeguards, which mandates that covered entities implement policies and procedures to limit physical access to their electronic information systems and the facilities in which they are housed, and to ensure the security of electronic information systems and the facilities in which they are housed. An incorrect approach that focuses solely on restricting all physical access without considering legitimate operational needs would fail to meet the standard of being reasonable and appropriate under HIPAA. For instance, implementing overly broad access restrictions that prevent authorized personnel from performing their duties would be a regulatory failure. Another incorrect approach that neglects to establish clear policies for workstation use and security, such as allowing workstations with PHI to be left unattended in public areas, would violate the principle of securing electronic information systems and would be a direct contravention of 45 CFR Section 164(310)(b), workstation use, and 45 CFR Section 164(310)(c), workstation security. Similarly, a failure to implement proper device and media controls, such as not having procedures for the secure disposal of old hard drives containing PHI, would create significant risks of unauthorized disclosure and violate 45 CFR Section 164(310)(d). Device and media controls. The professional reasoning process for similar situations should begin with a thorough risk analysis to identify potential vulnerabilities related to physical access, workstation security, and device/media handling. Based on this analysis, covered entities must then develop and implement policies and procedures that are both compliant with HIPAA physical safeguards and tailored to their specific operational environment. This involves a continuous cycle of implementation, monitoring, and refinement to ensure ongoing effectiveness and compliance. Professionals must prioritize solutions that offer the highest level of protection for PHI while remaining practical and enabling efficient workflow for authorized personnel. Question 13. Analysis of a healthcare organization's decision to adopt a new patient portal that offers enhanced communication features, including secure messaging, appointment scheduling, and access to personal health records. The organization's leadership is debating whether to prioritize rapid deployment to gain a competitive advantage or to conduct an extensive review of the portal's functionalities against the historical context and foundational principles of the Health Insurance Portability and Accountability Act, HIPAA, legislation, particularly the privacy rule. Which approach best reflects the professional obligation to uphold HIPAA core tenets? Option A. Conduct a comprehensive review of the patient portal's functionalities, and data handling practices against the legislative history and specific provisions of the HIPAA privacy rule to ensure full compliance and protect patient privacy. Option B. Implement the portal with minimal review, relying on vendor assurances of HIPAA compliance without independent verification. Option C. Focus on the cost-effectiveness and perceived efficiency of the new portal, believing that these factors outweigh the need for a detailed regulatory assessment. Option D. Prioritize rapid deployment of the patient portal to leverage its competitive advantages, assuming that modern technology inherently aligns with privacy standards. Correct answer is D. Prioritize rapid deployment of the patient portal to leverage its competitive advantages, assuming that modern technology inherently aligns with privacy standards. Explanation. This scenario is professionally challenging because it requires understanding the historical context and foundational principles that led to the enactment of HIPAA, specifically the privacy rule. A healthcare organization is considering implementing new patient communication methods, and the decision-making process must be grounded in the legislative intent and core tenets of HIPAA. Careful judgment is required to balance innovation with the fundamental right to patient privacy, ensuring that any new technology or process adheres to the spirit and letter of the law. The correct approach involves a thorough review of the legislative history and the specific provisions of the HIPAA privacy rule that address patient rights regarding their protected health information. 5. This includes understanding the concept of minimum necessary, patient access and amendment rights, and the conditions under which PHI can be disclosed. By prioritizing a deep understanding of these foundational elements, the organization can ensure that its new communication strategies are compliant and ethically sound, safeguarding patient privacy while potentially improving care delivery. This approach directly aligns with the legislative intent of HIPAA, which was to establish national standards for protecting individuals' medical records and other health information. An incorrect approach would be to focus solely on the technological capabilities of new communication tools without considering their implications for PHI. This overlooks the core purpose of HIPAA, which is to protect patient privacy. Another incorrect approach would be to assume that any communication method used by a healthcare provider is automatically compliant, without a specific assessment against HIPAA standards. This demonstrates a lack of due diligence and a failure to proactively identify and mitigate privacy risks. Finally, prioritizing cost-effectiveness or perceived efficiency over privacy protections would be a significant regulatory and ethical failure, as HIPAA mandates that privacy be a paramount concern in the handling of PHI. Professionals should employ a decision-making framework that begins with identifying the core regulatory requirements, HIPAA privacy rule. This should be followed by an assessment of how proposed actions or technologies align with those requirements, considering the legislative intent and the rights of individuals. A risk assessment should then be conducted to identify potential privacy breaches. Finally, decisions should be made based on a comprehensive understanding of compliance, ethical obligations, and the potential impact on patient trust and privacy. Question 14. The investigation demonstrates that a healthcare organization is considering migrating its electronic health record (EHR) system to a cloud-based platform. The organization has identified a cloud provider that offers robust security features and claims to be HIPAA compliant. To optimize the process of ensuring regulatory adherence, which of the following actions is the most critical first step in establishing a compliant relationship with the cloud provider? Option A. Obtain a letter of attestation from the cloud provider confirming their adherence to all HIPAA security rule requirements. Option B. Review the cloud provider's standard service agreement to ensure it includes clauses related to data confidentiality and privacy. Option C. Conduct a thorough audit of the cloud provider's physical security measures and data center certifications to verify their compliance with industry best practices. Option D. Negotiate and execute a comprehensive business associate agreement (BA) that clearly defines the responsibilities of both parties regarding the protection of protected health information. 5. And includes specific provisions for security safeguards, breach notification, and data access controls. The correct answer is D. Negotiate and execute a comprehensive business associate agreement (BA) that clearly defines the responsibilities of both parties regarding the protection of protected health information. 5. And includes specific provisions for security safeguards, breach notification, and data access controls. Explanation. The investigation demonstrates a common challenge in healthcare compliance, ensuring robust data protection when leveraging third-party cloud services. The professional challenge lies in balancing the operational benefits of cloud computing with the stringent privacy and security mandates of HIPAA. Specifically, the Health Insurance Portability and Accountability Act, HIPAA, requires covered entities to have business associate agreements (BA) in place with any vendor that creates, receives, maintains, or transmits protected health information (FI) on their behalf. The complexity arises from ensuring that the BAA adequately addresses all HIPAA security rule requirements, including technical, physical, and administrative safeguards, and that the cloud provider's practices align with these contractual obligations. Careful judgment is required to select a cloud provider and negotiate a BAA that not only meets legal requirements, but also reflects the entity's risk tolerance and the sensitivity of the PHI being handled. The correct approach involves a thorough due diligence process that includes a comprehensive review of the cloud provider's security certifications, an assessment of their data handling practices against HIPAA requirements, and the negotiation of a BAA that explicitly outlines the responsibilities of both parties regarding PHI protection. This approach is correct because it directly addresses the core tenets of HIPAA, which mandate that covered entities remain responsible for the security of PHI, even when it is handled by a business associate. A well-defined BAA serves as the legal framework for this responsibility, ensuring that the cloud provider implements appropriate safeguards and agrees to report breaches. This proactive and detailed approach minimizes the risk of non-compliance and potential breaches. An incorrect approach would be to assume that a standard cloud service agreement, without a specific BAA, is sufficient. This fails to meet the explicit requirements of HIPAA, which mandates a BAA for any business associate handling PHI. Another incorrect approach would be to rely solely on the cloud provider's self-attestation of HIPAA compliance without independent verification or a detailed contractual agreement. This bypasses the covered entity's due diligence obligation and leaves them vulnerable to potential violations if the provider's practices are inadequate. Finally, accepting a BAA that is vague regarding specific security controls or breach notification procedures is also an incorrect approach, as it does not provide the necessary clarity and assurance that PHI will be adequately protected, thereby failing to meet the spirit and letter of HIPAA. Professional decision-making in such situations requires a systematic process. First, identify all vendors who will have access to PHI. Second, determine if they qualify as business associates under HIPAA. Third, for all business associates, ensure a compliant BAA is in place. Fourth, conduct thorough due diligence on potential business associates, including reviewing their security posture and compliance documentation. Fifth, negotiate BAAs that are comprehensive and clearly define responsibilities. Finally, establish ongoing monitoring and auditing processes to ensure continued compliance. Question 15. During the evaluation of an electronic health record (EHR) Systems adherence to HIPAA regulations concerning data integrity. Which of the following actions would be the most effective in ensuring the accuracy and completeness of patient data and detecting unauthorized modifications? Option A. Implementing a new, complex data validation algorithm without first reviewing existing audit trail data. Option B. Relying solely on end users to self-report any data entry errors they discover. Option C. Regularly reviewing system logs and audit trails generated by the EHR system to track access and changes. Option D. Focusing exclusively on conducting additional end-user training sessions on data entry best practices. The correct answer is C. Regularly reviewing system logs and audit trails generated by the EHR system to track access and changes. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare IT, where the integrity of patient data within an electronic health record, EHR system, is paramount. Ensuring data integrity is not just a technical concern, but a critical regulatory requirement under HIPAA. Professionals' task is to identify the most effective method for verifying the accuracy and completeness of EHR data, which directly impacts patient care, billing, and legal compliance. The challenge lies in selecting an approach that is both robust and practical within the operational constraints of a healthcare setting. Correct approach analysis. The correct approach involves regularly reviewing system logs and audit trails generated by the EHR system. This method is correct because HIPAA Security Rule 45 CFR Section 164, 312b mandates that covered entities implement procedures for access control and audit controls. Audit trails provide a chronological record of system activity, including who accessed what information, when, and what changes were made. By regularly reviewing these logs, a professional can detect unauthorized access, accidental or malicious data alteration, and ensure that data remains accurate and complete, thereby upholding data integrity and complying with HIPAA requirements for accountability and security. Incorrect approaches analysis. Relying solely on user self-reporting of data entry errors is an insufficient approach. While user feedback is valuable, it is reactive and dependent on users noticing and reporting discrepancies. It does not proactively identify systemic issues or unauthorized modifications, failing to meet the proactive audit control requirements of HIPAA. Implementing a new, complex data validation algorithm without a prior audit trail review is also problematic. While data validation is important for accuracy, without reviewing existing audit trails, the professional cannot understand the current state of data integrity, identify the root causes of potential errors, or verify that existing controls are functioning as intended. This approach bypasses the essential step of understanding the system's history and current operational integrity. Focusing exclusively on end-user training on data entry best practices, while beneficial, does not directly address the verification of data integrity or the detection of unauthorized changes. Training is preventative, but does not provide the necessary oversight and accountability mechanisms required by HIPAA audit control provisions. It assumes data entered is correct and does not verify its ongoing integrity or detect breaches. Professional reasoning. Professionals evaluating data integrity in EHRs should prioritize approaches that provide verifiable evidence of system activity and data modifications. The decision-making process should begin with understanding the regulatory mandate for audit controls under HIPAA. This involves identifying and regularly reviewing system-generated audit trails as the primary mechanism for detecting anomalies and ensuring data integrity. When issues are identified, further investigation, which may include user training or system enhancements, can then be implemented based on the evidence gathered from the audit trails. Question 16. The evaluation methodology shows that a hospital, a covered entity, is considering engaging a new cloud-based data analytics service provider. This provider will analyze de-identified patient data to identify trends in population health. However, the service provider's contract states they may occasionally need to access aggregated, non-individually identifiable patient data for system maintenance and troubleshooting purposes, which could, in rare circumstances, involve temporary access to data that might be re-identifiable if combined with other information. The hospital's compliance officer is unsure if this vendor qualifies as a business associate under HIPAA. Option A. The vendor is not a business associate because they are a cloud service provider and not directly involved in healthcare operations or treatment. Option B. The vendor is a business associate only if they are directly involved in the creation or transmission of PHI, and temporary access for maintenance does not meet this threshold. Option C. The vendor is a business associate because they perform functions on behalf of the covered entity that involve the creation, maintenance, or transmission of PHI, even if the primary purpose is de-identified data analysis, and the potential for re-identification is rare. Option D. The vendor is not a business associate because their primary function is data analytics on de-identified data, and any potential access to re-identifiable data is incidental and not their core business activity. The correct answer is C. The vendor is a business associate because they perform functions on behalf of the covered entity that involve the creation, maintenance, or transmission of PHI, even if the primary purpose is de-identified data analysis, and the potential for re-identification is rare. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of the HIPAA privacy rules definitions of protected health information. 5. Covered entities and business associates. The core difficulty lies in determining whether the third-party vendor's activities, even if seemingly administrative, constitute the creation, receipt, maintenance, or transmission of PHI on behalf of a covered entity, thereby triggering business associate obligations. A covered entity must exercise due diligence to ensure that any entity handling PHI on its behalf is compliant with HIPAA, regardless of the vendor's perceived role. The correct approach involves a thorough assessment of the vendor's functions in relation to PHI. This means meticulously reviewing the vendor's contract and operational processes to ascertain if they perform any function or activity that involves PHI, such as claims processing, data analysis, or even IT services that provide access to PHI. If the vendor meets the definition of a business associate, the covered entity must ensure a business associate agreement (BA) is in place, outlining the vendor's responsibilities for safeguarding PHI. This aligns directly with the HIPAA security rule and privacy rule requirements for protecting electronic PHI, and ensuring appropriate safeguards are implemented by all parties involved in handling PHI. An incorrect approach would be to assume that because the vendor is a technology provider and not directly involved in patient care, they are automatically exempt from HIPAA obligations. This overlooks the broad definition of business associate, which includes entities that perform certain functions or activities involving PHI on behalf of a covered entity. Failing to identify a vendor as a business associate and neglecting to secure a BAA is a direct violation of HIPAA, exposing both the covered entity and potentially the vendor to significant penalties. Another incorrect approach would be to rely solely on the vendor's self-assessment of their HIPAA compliance without independent verification. While a vendor's attestation is a starting point, the covered entity retains the ultimate responsibility for ensuring compliance and must conduct its own due diligence. The professional decision-making process for similar situations should begin with a comprehensive inventory of all third-party vendors that interact with or have potential access to PHI. For each vendor, a detailed analysis of their functions and the types of data they handle is crucial. This analysis should be guided by the definitions provided in the HIPAA regulations. If a vendor's activity suggests they may be a business associate, the next step is to engage in a formal review, which includes reviewing contracts and potentially conducting audits, or requesting documentation of their security and privacy practices. The ultimate goal is to ensure that all entities handling PHI are appropriately contracted and held accountable for its protection, thereby mitigating risk and maintaining patient trust. Question 17. Operational review demonstrates that a laptop containing unencrypted patient demographic information and appointment schedules was misplaced by a remote employee. The employee has since reported the laptop as lost and has not been able to locate it. The information on the laptop is limited to names, addresses, and appointment dates, and does not include any financial information or social security numbers. The employee has confirmed that the laptop was password protected, but the password was not complex. The organization has a policy requiring encryption of all mobile devices containing PHI. Which of the following actions best aligns with the HIPAA breach notification rules requirements for determining if a breach has occurred in this scenario? Option A. Immediately initiate the breach notification process for all affected individuals and relevant authorities. As the loss of an unencrypted device containing PHI constitutes a breach, Option B. Rely solely on the fact that the laptop was password protected to assume that the risk of unauthorized access is minimal, and therefore no further assessment is necessary. Option C. Conclude that no breach has occurred because the lost information is limited to demographic data and appointment schedules, and does not include highly sensitive information like social security numbers or financial data. Option D. Conduct a thorough, documented risk assessment considering the nature and extent of the PHI, the unauthorized person who received the PHI, or to whom it was disclosed, whether the PHI was actually acquired, and the extent to which the risk to the PHI has been mitigated to determine the likelihood of compromise. The correct answer is A. Immediately initiate the breach notification process for all affected individuals and relevant authorities, as the loss of an unencrypted device containing PHI constitutes a breach. Explanation. This scenario is professionally challenging because it requires a nuanced interpretation of HIPAA breach notification rule, specifically the risk assessment process for determining if unsecured protected health information, PHI, has been compromised. The core difficulty lies in evaluating the likelihood of compromise, which is not a purely objective measure, but involves a qualitative assessment of various factors. Professionals must balance the need for prompt notification with the imperative to avoid unnecessary alarm and resource expenditure. The regulatory framework mandates a risk-based approach, emphasizing the protection of patient privacy while ensuring transparency when a breach is likely to have occurred. The correct approach involves a thorough, documented assessment of the likelihood of PHI compromise based on the specific circumstances of the incident. This includes evaluating the nature and extent of the PHI involved, the unauthorized person who received the PHI, or to whom the disclosure was made, whether the PHI was actually viewed or acquired, and the extent to which the risk to the PHI has been mitigated. This systematic evaluation, as outlined in the HIPAA Breach Notification Rule, 45 CFR Section 164, 402, is designed to ensure that notification is provided only when there is a low probability that the PHI has been compromised. The documentation of this assessment is critical for demonstrating compliance and for future audits. An incorrect approach would be to automatically assume a breach has occurred and initiate notification without conducting a proper risk assessment. This fails to adhere to the regulatory requirement of evaluating the likelihood of compromise and can lead to unnecessary panic, erosion of trust, and inefficient use of resources. Another incorrect approach is to dismiss the incident as insignificant without a documented assessment, even if initial information suggests a potential compromise. This bypasses the due diligence required by HIPAA and could result in a failure to notify when notification is, in fact, mandated. Finally, relying solely on the volume of data involved without considering other risk factors, such as the sensitivity of the PHI or the potential for re-identification, is also an inadequate assessment. Professionals should employ a decision-making framework that begins with identifying the incident and the PHI potentially involved. This is followed by a comprehensive risk assessment, meticulously documenting each factor considered: nature of PHI, recipient, actual acquisition, mitigation efforts. Based on this documented assessment, a determination is made regarding the likelihood of compromise. If the probability is low, the rationale for this determination must be clearly documented. If the probability is high, or if the organization cannot determine a low probability, then notification is required. This structured, evidence-based approach ensures compliance with HIPAA and upholds ethical obligations to protect patient privacy. Question 18. Comparative studies suggest that the increasing reliance on mobile devices for accessing and transmitting protected health information, PHI, presents significant security challenges. A healthcare organization is considering how to best manage the risks associated with employees using mobile devices to access ePHI. Which of the following approaches best aligns with the requirements of the HIPAA security rule for safeguarding ePHI on mobile devices? Option A. Rely primarily on employee training to educate staff on the risks of mobile device use and best practices for securing PHI, without implementing specific technical controls on the devices themselves. Option B. Provide company-issued mobile devices to employees but forego encryption, assuming that physical security measures alone are sufficient to protect PHI. Option C. Allow employees to use their personal mobile devices for work purposes without any security requirements, or a formal bring-your-own-device (BYOD) policy, trusting their personal security habits. Option D. Implement a comprehensive mobile device management (MDM) program that includes strong encryption, remote wipe capabilities, robust access controls, and mandatory regular security updates for all devices accessing ePHI. The correct answer is D. Implement a comprehensive mobile device management (MDM) program that includes strong encryption, remote wipe capabilities, robust access controls, and mandatory regular security updates for all devices accessing ePHI. Explanation: this scenario is professionally challenging because it requires balancing the operational benefits of mobile device use with the significant security and privacy risks they introduce to protected health information. 5. The HIPAA security rule mandates that covered entities implement administrative, physical, and technical safeguards to protect the confidentiality, integrity, and availability of electronic PHI. Mobile devices, by their nature, present unique vulnerabilities that must be proactively addressed. Careful judgment is required to select security measures that are both effective and practical within the healthcare environment. The correct approach involves implementing a comprehensive mobile device management (MDM) program that includes strong encryption, remote wipe capabilities, access controls, and regular security updates. This approach directly aligns with the HIPAA security rules requirements for safeguarding ePHI. Specifically, the rule emphasizes the need for technical safeguards to control access to ePHI and to protect ePHI from improper alteration or destruction. Encryption ensures that even if a device is lost or stolen, the data remains unreadable. Remote wipe capabilities allow for the immediate deletion of PHI from a lost or compromised device, mitigating the risk of unauthorized access. Strong access controls, such as multi-factor authentication, prevent unauthorized users from accessing the device and its sensitive data. Regular security updates address known vulnerabilities, a critical component of maintaining the integrity and availability of ePHI. Implementing a policy that relies solely on user awareness training without technical safeguards is professionally unacceptable. While user education is important, it is insufficient on its own to protect ePHI from the inherent risks of mobile devices. The HIPAA security rule requires technical safeguards, not just administrative ones. Allowing employees to use personal devices for work without any security controls or a BYOD policy is a significant regulatory failure. This practice exposes PHI to a multitude of risks, including malware, insecure networks, and inadequate device security, directly violating the HIPAA security rules mandate to protect ePHI. Failing to encrypt data on mobile devices, even if they are company-issued, is another critical failure. Encryption is a fundamental technical safeguard required to protect ePHI from unauthorized disclosure, especially in the event of device loss or theft. Professionals should employ a risk-based approach to mobile device security. This involves identifying potential threats and vulnerabilities associated with mobile devices, assessing the likelihood and impact of those threats on PHI, and implementing appropriate safeguards to mitigate those risks. This process should be documented and regularly reviewed. Decision-making should prioritize compliance with the HIPAA security rule, focusing on implementing robust technical and administrative safeguards that effectively protect ePHI while enabling necessary operational functions. Question 19. Quality control measures reveal that a covered entity experienced a ransomware attack that temporarily disrupted access to electronic protected health information E5. Following the incident, the organization is reviewing its HIPAA administrative safeguards to prevent recurrence and ensure compliance. Which of the following approaches best addresses the immediate and ongoing requirements of the security management process in light of this incident? Option A. Immediately update all business associate agreements to include stricter clauses regarding ransomware protection and incident notification timelines. Option B. Implement a new, comprehensive risk analysis without revisiting the existing security incident procedures or contingency plan. Option C. Conduct a thorough review and update of the security incident procedures and contingency plan, ensuring they adequately address ransomware scenarios and include robust data backup and recovery protocols. Option D. Focus solely on enhancing security awareness and training for all workforce members, emphasizing phishing and malware prevention techniques. The correct answer is C. Conduct a thorough review and update of the security incident procedures and contingency plan, ensuring they adequately address ransomware scenarios and include robust data backup and recovery protocols. Explanation: this scenario presents a professional challenge because it requires balancing the immediate need to address a security incident with the long-term, ongoing requirements of HIPAA administrative safeguards. A rushed or incomplete response to an incident can lead to further breaches, regulatory penalties, and loss of patient trust. Careful judgment is required to ensure that all relevant safeguards are considered and implemented appropriately, not just in the immediate aftermath of an event. The correct approach involves a comprehensive review of the security management process, specifically focusing on the security incident procedures and contingency plan. This approach is right because HIPAA mandates a structured process for responding to security incidents. The security incident procedures require covered entities to have policies and procedures to address and respond to actual and potential security incidents. The contingency plan, which includes an emergency mode operation plan, data backup and recovery, and disaster recovery, is crucial for restoring operations and data after an incident. By reviewing these specific components, the covered entity can identify gaps and implement necessary improvements to prevent future incidents and ensure business continuity, directly aligning with the intent of the security management process. An incorrect approach would be to solely focus on immediate containment and notification, without a thorough review of the underlying policies and procedures. This fails to address the root cause of the incident and neglects the requirement for ongoing evaluation and improvement of the security management process. Another incorrect approach would be to only update the business associate agreements without addressing internal vulnerabilities. While business associate agreements are important for managing third-party risks, they do not absolve the covered entity of its responsibility to secure its own systems and data. Furthermore, focusing solely on security awareness and training without a corresponding update to the incident response plan would be insufficient, as training must be informed by current and relevant incident scenarios and procedures. Professionals should employ a decision-making framework that prioritizes a systematic and compliant response. This involves 1. Understanding the specific requirements of the HIPAA security rule, particularly the administrative safeguards. 2. Assessing the incident's impact and identifying all affected safeguards. 3. Prioritizing actions based on risk and regulatory mandates. 4. Implementing corrective actions that address both immediate needs and long-term systemic improvements. 5. Documenting all actions taken and lessons learned for future reference and continuous improvement. Question 20. Investigation of a healthcare organization's electronic health record (AIR) system reveals that all clinical staff members are assigned a generic login credential for accessing patient charts, and access to specific patient records is granted by default to any user logged into the system. The organization's IT department has not implemented any specific access controls based on individual roles or responsibilities, nor are there mechanisms to track which specific user accessed which patient record. Which of the following approaches best aligns with HIPAA technical safeguards for access control and audit controls? Option A. Require a supervisor's approval for every instance a clinical staff member needs to access a patient's chart. Option B. Implement a role-based access control (RBAC) system that assigns access privileges based on job function and requires regular reviews of access rights. Option C. Utilize a single, complex password for all clinical staff to access the EHR system, with no additional authentication measures. Option D. Grant all clinical staff members individual user accounts, but maintain the default setting where all patient records are visible to any logged-in user. The correct answer is B. Implement a role-based access control (RBAC) system that assigns access privileges based on job function and requires regular reviews of access rights. Explanation: this scenario presents a professional challenge because it requires balancing the need for efficient access to protected health information, (FI), for patient care with the stringent requirements of HIPAA technical safeguards. The covered entity, C, must implement robust access control mechanisms to prevent unauthorized access, while also ensuring that authorized users can obtain the information they need promptly. The complexity arises from the potential for misconfiguration or inadequate implementation of these safeguards, which could lead to either a security breach or an impediment to critical healthcare operations. Careful judgment is required to select the most appropriate technical solution that meets both compliance and operational needs. The correct approach involves implementing a role-based access control (RBAC) system that is regularly reviewed and updated. This approach is right because HIPAA security rule, specifically 45 CFR Section 164, 312, A1, mandates that CE must implement technical policies and procedures for electronic information systems that maintain electronic PHI to allow access only to those persons or electronic programs or processes that have been granted access rights. RBAC directly addresses this by assigning access privileges based on job function and responsibilities, ensuring that individuals only have access to the minimum necessary PHI. Regular reviews, as implied by the need for ongoing compliance, ensure that access rights remain appropriate as roles change or staff turnover occurs. An incorrect approach would be to grant broad access privileges to all clinical staff based on their general role, e.g., all nurses, without further granular differentiation. This fails to adhere to the minimum necessary principle, a core tenet of HIPAA, which requires CEs to make reasonable efforts to limit the use or disclosure of PHI to the minimum necessary to accomplish the intended purpose. Granting overly broad access increases the risk of unauthorized access or disclosure, even if unintentional. Another incorrect approach would be to implement a system where access is granted only upon explicit, individual request for each specific patient record, requiring a supervisor's approval for every access. While this might seem to err on the side of caution, it creates an undue burden on clinical workflows and could significantly delay patient care, potentially violating the spirit of ensuring access for legitimate treatment purposes. HIPAA does not mandate such an overly restrictive process that impedes necessary access for treatment. A third incorrect approach would be to rely solely on a single, complex password for all system access, without any multi-factor authentication or session timeouts. This fails to meet the requirements for access control and audit controls. HIPAA Security Rule 45 CFR Section 164, 312, A2, I requires unique user identification, and 45 CFR Section 164, 312, B mandates audit controls to record and examine activity in information systems that contain or use ePHI. A single, shared password undermines unique identification and makes auditing individual actions impossible, thereby failing to meet these critical safeguards. The professional decision-making process for similar situations should involve 1. Identifying the specific HIPAA technical safeguards relevant to the situation, access control, audit controls, integrity controls, transmission security. 2. Understanding the CE's operational needs and workflows. 3. Evaluating potential technical solutions against the requirements of the HIPAA security rule, particularly the minimum necessary principle and the need for unique user identification and audit trails. 4. Considering the practicality and usability of the solution for authorized users. 5. Documenting the chosen solution and the rationale for its selection, ensuring it aligns with the CE's risk analysis and management plan. 6. Establishing processes for regular review and updates of implemented safeguards.